Today we are discussing Lycopodium. Depression of mind and sensorium, stupid, lower jaw drops, chronic conditions, memory fails, uses wrong words to express himself, mixes up things, failing brain power. So the first most significant symptom is forgetfulness. Right-sided complaints begins on right and travels leftward. Throat, ovaries, uterine region, kidney and skin troubles, hernia. The second significant symptom is right-sided complaints that travel leftward. Sense of satiety or hunger but soon fills up. Easy satiety is the next symptom. Great flatulence with rumbling, mostly intestinal and pressing downward. Downward pressing flatulence is the next significant symptom. Red sand in clear urine. Pains in back or kidneys are relieved after passing urine. Pain in the back, relieved after passing urine. And there will be red sand, sedimentation of a red sand in the urine. Dark complexion people, emaciated in face, upper parts bloated or swollen in lower. Emaciated face and upper parts, bloated or swollen lower parts. Keen intellectual but feeble muscular development. Modalities 4 to 8 p.m. after eating in warm room. Complaints are aggravated. Complaints are ameliorated in cool open air on motion. Generally a very warm-blooded hot patient. And there is an evening aggravation. Irritable. Peevish and cross on waking, ugly, kick and scream, particularly in children. Easily angered, cannot endure opposition or contradiction. They don't like to be contradicted. Seeks disputes. Is beside himself. Complexion pale, dirty, unhealthy, sallow, looks older than he is. Looks older than he is because of graying of hair and the unhealthy complexion. One foot hot and the other cold. This may happen in fevers and acute conditions. Great thirst after the sweat. So in fevers after the sweat, there will be great thirst, which is generally not the case. Chill on left side of the body. Causticum, Carbovage are other medicines for left-sided chills. Sour vomiting between chill and heat. Must uncover. Perspiration immediately after the chill. Thirst after sweating stage. In intermittents, the flatulence, sour eructations, sour taste, sour sweat, sour vomiting. Everything is sour about this medicine. Sour vomiting. This remedy with sulfur and calcarea forms the leading trio of Hahnemann's antisoric remedies. Sulfur, calcarea, Lycopodium is Hahnemann's classification of antisoric remedies. Arsenicum and phosphorus are also antisoric remedies, but the trio of antisoric remedies is sulfur, calcarea, and Lycopodium. This makes a good starting point, as the boy said when he set a pin in a vacant chair. They all act very deeply. Each finds its affinity in a certain class of people or temperament. Lycopodium acts favorably in all ages, but particularly upon old people and children. It acts upon persons of keen intellect, but feeble muscular development. Lean people, leaning towards lung and liver affections. Lung troubles, liver troubles. Such people are apt to suffer from lactic acid diathesis, for which this is also a great remedy. The Lycopodium subject is sallow, sunken, with premature lines in the face. Looks older than he is. There are a lot of lines in the face. A wrinkling. Children are weak with well-developed heads, but puny, sickly bodies. Head is big, and the body is sick and small. They are irritable, and when sick, awake out of sleep, ugly, and kick and scream and push away the nurse or patients. These temperament remedies are not always appreciated by those who don't understand the true spirit of our own art of healing. But when appreciated, the skillful observer can often see the picture of the right remedy in the face and build of his patient before he speaks a word. A remedy must not only be well proven, but extended clinical use and observation is necessary to develop it and indicate its true sphere of usefulness. I have known temperament so intensely, aconite or belladonna, that they could not take these remedies except in the high and highest potencies, and then only in single doses at long intervals. Why should this be thought incredible? Carpenter, in his Physiology, tells of a person who was so susceptible to mercury that she was salivated by sleeping with her husband who had taken mercury. This is one of the leading trio of flatulent remedies, Lycopodium, along with carboveg and China. With Lycopodium, there seems to be an almost constant fermentation of gas going on in the abdomen, which produces a loud croaking and rumbling. Remember, while China bloats the whole abdomen, carboveg prefers the upper abdomen, and Lycopodium the lower parts. With Lycopodium, this flatulent condition is very apt to occur in connection with chronic liver trouble. Again, this rumbling of flatulence is often found particularly in the region of the splenic flexure of the colon or left hypochondria. Left hypochondria. This is a right-sided remedy, but this particular thing is felt in the left hypochondria. A feeling of satiety is found under this remedy, which alternates with a feeling of hunger of a peculiar kind. The patient sits down to the table very hungry, but the first few mouthfuls fill him right up, and he feels distressingly full. In a Pickwickian sense, too full for utterance. This alternation of hunger and satiety is not markedly found under any other remedy, and it is very specific to Lycopodium. If the patient would say that I feel full very soon, like I eat a few mouthfuls and I feel very full, and there is a lot of gas in the forming in my abdomen, and the gas is pushing downwards. It doesn't come upwards, it's pushing downwards, and then passing flatus relieves. Lycopodium is a remedy. Constipation predominates under Lycopodium, and like nux vomica, there may be frequent and ineffectual desire for stool. But while that of nux vomica is caused by irregular peristaltic action, that of Lycopodium seems to be caused by spasmodic contraction of the anus, which prevents the stool and causes great pain. So the patient would go to the bathroom and nothing passes. There is a spasmodic contraction of the anus. The anus just contracts, when they try to pass stool. Nux vomica, there is no peristalsis, there is no movement. Or there is irregular peristalsis. That is the right way to describe it. No peristalsis is kind of alumina or bryonia. Irregular peristalsis, they go to pass stool and then they feel like vomiting, retching, vomiting, these kind of things, because the peristalsis is happening in the opposite direction. Lycopodium should be thought of in anal troubles associated with chronic liver troubles, especially if with much flatulence. Lycopodium is of use in a right-sided hernia. Left hypochondria for the gas, and for hernia, right-sided hernia. It has cured cases of long standing without the aid of a truce. The liver troubles of Lycopodium are more apt to be of the atrophic variety, while those of China are hypertrophic, both being equally useful in their sphere. Lycopodium has almost, if not quite, a marked action upon the urinary organs as upon the liver. It is a chief remedy for red sand in the urine. This is not simply the reddish sediment which is generally termed a brick dust sediment, and which is found under many other remedies, but is an actual sandy, gritty sediment that settles at the bottom of the otherwise perfectly clear urine. Unless this condition is removed, we have sooner or later renal calculi or gravel forming and terrible attacks of renal colic. In children, this sand is sometimes found in the diaper after severe crying spells, and in adults, much pain in the back in the region of kidneys, which is relieved after the discharge of urine containing the sand. See borax, sarsaparilla, and sanicula. No one remedy helps these cases more promptly or permanently than Lycopodium. Lycopodium is also one of our best remedies for impotence. Agnus castus is another remedy for impotence. An old man marries his second or third wives and finds himself not equal to the task. It is very embarrassing for the whole family. A dose of Lycopodium sets the thing all right and makes the doctor a warm friend on both sides of the house. Young men from masturbation or sexual excess become impotent. The penis becomes small, cold, and relaxed. The desire is as strong as ever, and perhaps more so, but he can't perform. Other remedies are selenium and caladium. I have known apparently hopeless cases of this kind cured by the use of this remedy, high single doses, at intervals of a week or more. Give it low, however, if you want to, but do not blame me if you do not succeed. Lycopodium affects the right side most, or at least the troubles begin on the right side. Swelling and suppuration of the tonsils I have aborted more than once in old quinsy subjects with an early dose of this remedy. In fact, I have such success with Lacosis, Lycopodium, Lacaninum, and Phytolacca that some who employ me for nothing else come for those powders that break up quinsy so quick. In diphtheria, if the disease begins in the right tonsil or right side of the nose and extends to the left, you will think of Lycopodium, but remember that mercurius protoiodide also begins on the right side, but there is no difficulty in choosing between the two. Bromine diphtheria begins below and comes upward, just the reverse of Lycopodium. Pains in the abdomen, ovarian, and uterine regions also begin in the right side, running from right to left. Right foot gets cold, while the other foot remains warm. Eruptions begin on right and travel across to left side. Sciatica the same. Any complaint that begins on the right and goes to left makes me think of Lycopodium. The sides of the body subject is of more account than some imagine. Drugs have an affinity for particular parts, organs, and even sides of the body. Upon the respiratory organs, this remedy also has a strong influence. It is one of our best remedies for chronic dry catarrh of nose, which becomes completely closed so that the patient has to breathe through the open mouth, especially at night. Here the choice often lies between this remedy, ammonium carb, and hepatic sulfur. Other symptoms, of course, deciding the choice. So this is dry nose, and the nose becomes obstructed at night. Hepatic sulfur, Lycopodium, ammonium carb. In infants, Sambucus also comes in for a share of attention. Lycopodium has often saved neglected, maltreated, or imperfectly cured cases of pneumonia from running into consumption. It may even come into the later stages of the acute attack itself, and here, as usual, the disease is apt to be in the right lung, and especially if liver complications arise. Here the choice may have to be between this remedy and sulfur, kali hydroiodicum, or silicia. The characteristic aggravation as to time of this remedy is from 4 to 8 p.m. Colocynth has 4 to 9 p.m. aggravation of abdominal pains, and Helleborus of the headache with coryza. But the 4 to 8 aggravations of Lycopodium are general, not confined to any one or one set of symptoms. Lycopodium profoundly impresses the sensorium. We see by studying its pathogenesis that it depresses. This is found particularly in typhoid. The patient lies stupid, eyes do not react to light, lower jaw drops, apparent impending paralysis of brain. This condition may also be found in the advanced stage of many different acute diseases such as cerebrospinal meningitis,